In the fitness world, we tend to treat the human body a lot like a rubber band.
Yeah, that's a really good way to put it.
Right. Like you stretch it, maybe you injure it in a game or you tear a muscle.
Hmm.
And then the entire focus of your physical therapy is just getting that rubber band to, snap right back to its original shape.
Exactly. We are completely obsessed with the before picture.
Yes. The whole narrative is always about reclaiming what you lost. But what happens when you physically cannot go back?
Right, because that traditional framework just completely falls apart when the actual physical architecture of the body has been permanently altered.
And that's really the core tension we're diving into today for you listening. What happens when the rubber band is just cut?
Yeah, when you go through a trauma so severe that physically, biomechanically, you can't go back.
Exactly. So today we're taking a deep dive into the physical and psychological reconstruction that has to happen after a double breast cancer diagnosis.
It's such an important topic.
It really is. And our grounding material for this is a really detailed analysis by Caroline Berger de Femini.
Right, the founder of Studio Biopilates Paris.
Yes, and her work, I mean, it really forces us to just discard that whole traditional fitness narrative entirely.
Oh, absolutely.
Yeah.
Because, after going through multiple complex surgeries, heavy oncology treatments, and just dealing with expansive scar tissue.
Not to mention the systemic fatigue.
Exactly. A person cannot just step onto a treadmill and try to, re-muscle their way back to normal.
Right. So for you listening, our mission today isn't about, how to get a beach body or optimizing your core routine.
No, definitely not.
We are unpacking how adapted Pilates acts as a bridge for someone to learn to inhabit a radically transformed body.
A body that, honestly, might be actively in pain.
Yeah, or feel completely alien. Or even just feel like a fragile stranger to the person actually living inside it.
And to really understand how someone rebuilds that relationship with their physical self, we have to look at the sheer mechanical reality of what the trauma has done.
Okay, where do we start with that?
Well, the source draws this really sharp, crucial distinction between the biomechanical aftermath of a single mastectomy versus a double mastectomy.
I mean, I always understood both were major traumas, obviously, but the biomechanical implications are worlds apart, aren't they?
Vastly different. Because in a unilateral, a single breast cancer surgery, the human body acts like a master compensator.
Oh, interesting. How so?
It instinctively reorganizes its center of gravity. So it will physically lean on the non-operated, the quote-unquote good side to protect the injured one.
Ah, right.
Yeah, the spine might curve slightly, the shoulder will hike up,
Yeah.
but the body basically finds a way to balance the load.
But with a double, I mean, that whole strategy just vanishes.
Exactly. There's no good side to lean on. The entire front of your torso is the trauma site.
Wow. And that just obliterates a person's physical support structure.
It really does.
Yeah.
When both sides of the thorax are involved, those natural compensations are just impossible.
So what does that mean for everyday movement?
Well, your trunk, the way your shoulders sit, the way your ribs expand, even like the way your feet distribute weight on the ground to keep you upright.
Wait, even your feet?
Yeah. It all has to be completely reorganized. You are essentially learning how to hold your skeleton up all over again.
That is just, it's incredibly daunting. And the landscape you're working with sounds so difficult. We're talking about multiple scars, right?
Mm-hmm. Lots of scar tissue.
And the text specifically highlights how these scars create adhesions underneath the skin.
Right, which is a major issue.
Can I understand that correctly? The layers of muscle and fascia and skin that are supposed to, slide smoothly over each other, they end up acting like they've been glued together.
Internal superglue is actually a really accurate way to picture an adhesion. It just locks down the tissue.
Yikes.
And when you combine those adhesions with the loss of breast tissue and the tightness from radiation, you get this severely limited rib cage mobility.
Because everything is just pulled tight.
Exactly. And because the body's an interconnected web, that tension doesn't just stay in the chest.
It spreads.
Right. It crawls up into the neck and it radiates down the back.
Which leads to this phenomenon the patients in the source describe. They talk about this overwhelming sensation of wearing a carapace or a shell around their thorax.
Yeah, that's a very common description.
And it's not just a physical stiffness, right? It translates into a very real psychological fear.
Absolutely. A fear of lifting their arms, a total loss of confidence in reaching for, say, a glass on a high shelf.
Yeah, just a deep terror of putting strain on the operated areas. I keep picturing A turtle pulling into its shell. You know, that protective
Oh,
posture.
that turtle analogy is perfect for understanding the nervous system's role here.
Oh, where the shoulders close inward, the upper back curves into like a C shape, the head juts forward, and the ribs just get locked down.
Exactly.
But wait, in any normal fitness context, right, if I walk into a gym with my shoulders rounded and my chest caved in, a trainer is going to tell me I have terrible posture.
Oh, yeah, they'd tell you to fix it immediately.
Right, they'd say forcefully pull your shoulders back right now. But this source specifically calls this protective turtle shell an intelligent response. Why would we ever call a bad posture intelligent?
Because your nervous system isn't trying to win a posture contest. It's trying to survive.
Okay, that makes sense.
It is actively protecting a vulnerable area from pain and insecurity.
So it's basically a shield.
Exactly. Curling around an injured core to shield it from further harm is a brilliantly intelligent evolutionary defense mechanism.
Right.
I mean, if you have major wounds on your chest, standing up completely straight and stretching that fragile tissue to its absolute limit is the last thing your brain wants you to do.
Okay, so the initial reflex makes perfect sense. It's a survival tactic.
The danger, though, is when that temporary survival tactic becomes a permanent baseline.
Oh, right. Because you can't stay a turtle forever.
No, you can't. If that rigid, closed shell settles in long-term, it breeds chronic secondary issues. Your back will ache constantly, your breathing remains restricted, and you're just left in this state of lingering systemic fatigue.
So how do you fix it without freaking the body out?
Well, the goal of adapted Pilates is never to violently crack the shell open or, force the turtle out.
Because that would just cause more panic.
Exactly. That will just trigger the nervous system to clamp down even harder. You have to slowly, safely coax the body to realize the danger has passed.
But if someone is physically and mentally trapped in that rigid posture, you can't just order them to move their arms.
No, definitely not.
You have to find a back door into their nervous system.
Yeah.
And according to the text, that back door is the most fundamental movement we have, which is the breath.
Breathing is the absolute foundation here. It
Yeah.
really is.
Why is that?
Well, it connects the mind to the physical form, and it regulates the nervous system. But we have to look at the mechanics of how a patient is actually breathing after this kind of trauma.
Right, because of the adhesions and the fear we just talked about.
Exactly. Because of all that, patients are often locked into taking really high, shallow breaths.
Because taking a deep belly breath would stretch the tight chest tissue and cause pain.
And because the primary breathing muscle, the diaphragm, it can't descend properly when the rib cage is locked.
Ah, I didn't even think of that.
Yeah, so the body still needs oxygen, obviously, and it panics. It recruits secondary respiratory muscles in the neck.
The trapezius and the scalens, right?
Yes, it uses them to physically yank the top of the rib cage up just to get air in.
So you're basically shrugging your shoulders every single time you inhale.
Pretty much.
No wonder they're exhausted. I mean, doing a shoulder shrug 20,000 times a day sounds agonizing.
It creates massive neck tension and terrible headaches.
I bet.
So to counter this, adapted Pilates introduces lateral thoracic breathing.
Okay, what does that look like?
Instead of breathing high into the neck or pushing the belly out, the instructor guides the patient to breathe sideways into the lower ribs. Imagine your rib cage expanding laterally, sort of like an accordion.
But even that sounds like it could pull on the scars, couldn't it?
It could, which is why the source really emphasizes the word invitation.
Invitation, okay.
Yeah, lateral breathing is proposed as an invitation to the body, never a constraint. The instructor might place their hands gently on the sides of the patient's ribs and just, ask them to breathe into that space.
Oh, I see.
It's a way of gently restoring mobility from the inside out, using the air to stretch the tissue rather than forcing a physical movement.
Okay, let's unpack this a bit more, specifically the physical movement part, because eventually the arms do have to move.
Right, you can't just breathe forever.
Exactly. And one of the biggest challenges highlighted in the material is shoulder mobility. The text points out that surgeries, radiation, and specifically lymph node removal, curettage, ganglionaire,
Yes, that's a big one.
that it can completely wreck something called the scapulohumeral rhythm. What is that?
The scapulohumeral rhythm is this really complex, highly synchronized dance between your shoulder blade, the scapula, and your arm bone, the humerus.
Okay.
For you to lift your arm over your head smoothly, the shoulder blade has to glide and rotate across your back in perfect proportion to the arm lifting.
And I imagine scar tissue acts like gum in the gears of that movement.
That's exactly what it does.
Plus, if lymph nodes are removed, you're disrupting the body's plumbing system, basically.
Right, the lymphatic fluid backs up.
Which causes lymphedema, making the arm swell and become incredibly heavy.
Very heavy and very painful.
So trying to fix a stuck heavy shoulder by just telling someone to push through the stiffness feels like trying to yank open a jammed door. You're going to snap a hinge.
Oh, without a doubt.
So with all this talk of mobilizing a traumatized area, isn't there a massive risk of a Pilates instructor doing too much too fast and actually injuring the patient further?
The risk is substantial, absolutely. Which is why the medical boundaries in this text are absolute ironclad.
Okay, good to know.
Adapted Pilates does not replace oncological physiotherapy. It does not replace a doctor. It is a complementary approach.
So it's a team effort.
Entirely. And before a patient even steps foot in the studio, mandatory approval from the medical team is required.
So there's definitely no pain, no gain mentality here.
It's the exact opposite, honestly. Caroline Burrier the Femini lays out a golden rule.
Which is?
Absolutely no sharp pain, no swelling, no feeling of excessive pulling, and no burning sensations in the scars.
Wow, that's very strict.
It has to be. If a movement causes any of those red flags, the instructor stops immediately. They reduce the range of motion, they remove the resistance, they modify the angle.
You're just operating entirely within the patient's safe zone.
100%.
That level of delicacy is fascinating, especially when we look at how they actually achieve it. Which brings us to a part of the text I found deeply counterintuitive.
With the equipment.
Yes. Because we know the body is fragile. We know the movements must be hyper-controlled and safe. And yet, the tool they use to achieve this isn't just a soft yoga mat on the floor.
Right.
It's the heavy machinery of a fully equipped Pilates studio.
It surprises a lot of people. A lot of people assume mat work is the safest, gentlest form of exercise because, well, you're close to the ground.
Right, to feel safer.
But for a post-operative body, the floor is actually a really hostile environment.
How so?
When you lie on a mat and try to lift your arm, gravity is relentless. Your shoulder joint has to bear the entire weight of that limb against the downward pull of gravity.
Oh, wow. And if your shoulder was just operated on and your arm feels heavy from lymphatic swelling,
Exactly.
lifting it off the floor probably feels like hoisting a ton of bricks.
It's unmanageable. That is where the specialized Pilates apparatus becomes absolutely vital.
But wait, if you have ever seen a fully equipped Pilates studio,
That's true.
it looks terrifying.
It does look pretty intense.
You walk in and see the reformer, the Cadillac, the barrels, the window chair. It's this intimidating forest of wooden frames, leather straps, metal springs, and bars.
Very true.
It honestly looks like a medieval torture chamber. I mean, if I am already terrified of my fragile body, getting strapped into a complex machine sounds like a nightmare. Why wouldn't we just start seated on a chair or laying on a mat?
Because of the brilliant paradox of those machines.
Okay, tell me more.
They look imposing, sure, but the springs and straps provide the exact physical support that the traumatized body lacks. Let's go back to your turtle analogy, actually.
Okay.
A turtle feels heavy and restricted on dry land, right? But when it slides into the water, buoyancy takes over.
Oh, that makes sense.
The water supports its weight, and it can move freely. The springs on a Pilates machine act exactly like that water.
So the springs provide buoyancy for the limbs.
Precisely. If a patient is on the Cadillac, for example, their arm can be placed into a supportive sling attached to a highly calibrated, really light spring above them.
Oh, so it pulls the weight up.
Right. That spring literally absorbs the burden of gravity. It holds the weight of the arm so the fragile shoulder joint doesn't have to.
That's incredible.
It really is. The patient can experience the sensation of a full range of motion, letting the shoulder blade glide without any of the strain.
The machine carries the weight for you while your nervous system relearns the motion.
Exactly. And every piece of equipment serves a highly specific function in this phase. The reformer uses a sliding carriage and springs to adjust resistance.
So it's never too heavy.
Right, ensuring the patient never faces a brutal, unmanageable load. The Cadillac offers those overhead straps for highly assisted work.
What about those barrels? They look tricky.
The barrels, those curved surfaces, they are used with extreme caution to slowly encourage the chest to open and improve that thoracic mobility.
And the chair.
The chair is much more demanding in terms of core stability. So a good instructor saves that for much later in the recovery process when real strength is finally returned.
It's just an incredible physical safety net. But what the article really drives home, and what I think is the most profound takeaway from all these sources, is how that mechanical support directly translates into psychological safety.
Oh, the two are inseparable.
Right.
When a patient feels the spring holding the weight of their arm, their nervous system finally gets the signal that it's safe to let go of that rigid turtle shell.
It can finally relax.
Yes, but this process demands deep listening from the instructor. Patients arrive at the studio in vastly different mental states.
I can imagine.
Some are entirely disconnected from their physical form. I mean,
Yeah.
they might not even recognize this new, scarred version of themselves in the mirror.
And on the flip side, you have the type A personalities.
Oh, yes.
People operating on sheer willpower who want to treat recovery like a to-do list. They rush through the exercises, gritting their teeth, trying to forcefully snap that rubber band back.
And drag their old life back into
Yeah,
existence, exactly.
Right.
And in those cases, the instructor's primary job is to actively slow them down.
To get them to just breathe.
Right, to observe their breathing, to stop them when their neck muscles tense up, and to reassure them that the goal of the session isn't athletic performance.
Right, it's not a competition.
The goal is the progressive return of trust. You can't bully a traumatized body into trusting you.
Here's where it gets really interesting, though. The article grounds all of this theory in a beautiful, real-world example. It shares the story of Robin Allison Davis.
Yes, her story is so powerful.
She's an American author who wrote a book called Surviving Paris about her own intense breast cancer journey. And the text highlights her because she didn't just use adapted Pilates to recover.
No, she took it much further.
She actually went on to participate in the intensive reformer training at BioPilates Paris after her illness.
It's a remarkable trajectory. She transitioned from being a patient, cautiously navigating a traumatized, unfamiliar body, to mastering the very apparatus that helped heal her.
Her story really proves something vital that the author states very clearly, which is that movement doesn't cure cancer.
No, of course not.
Pilates doesn't erase the disease or the trauma of the surgeries, but what it does is repair autonomy.
Absolutely.
It rebuilds confidence and that deep-seated feeling of bodily security that the hospital experience often strips away.
To give them their agency back.
Yes, the text describes movement becoming a language, an act of pure resilience. There is a specific quote from the text that I think perfectly summarizes our entire mission today.
Let's hear it.
The author writes, "It is not about returning to the body of before. It is about learning to accompany the body of today."
That is it's a radical shift in perspective.
It really is.
If we connect this to the broader concept of healthcare, it fundamentally redefines what it means to be healed.
Because usually we just think of healed as the end of treatment.
Right. In a purely clinical context, we often view healing as just the absence of symptoms.
Yeah.
The tumor is gone, the incisions have closed, your blood work is clear.
Therefore, you are healed.
Exactly. But the reality of the patient's lived experience is completely different.
Yeah, that makes a ton of sense.
Robin Allison Davis's story and the core philosophy of adapted Pilates argue that true healing is the presence of a coherent inner self.
Wow.
It is the ability to look at a body that has new scars, new limitations, and profound fragilities, and instead of mourning the ghost of what it used to be, you actively discover its new possibilities.
You are making peace with the vessel you live in.
It is an act of deep reconciliation, yes.
Making peace with the vessel. So, for you listening, let's look at the journey we've just unpacked today.
We covered a lot of ground.
We really did. We started by dismantling the myth of the rubber band, the idea that you must bounce back to your before picture.
Right.
We looked closely at the uncompensatable trauma of a double mastectomy and understood why the body intelligently but painfully pulls into a protective shell.
The turtle.
Yes, the turtle. We saw how something as simple as lateral breathing can act as a gentle backdoor to the nervous system.
And how those intimidating springs and straps act like water.
Exactly, offering buoyancy and a gravity-defying safety net. And finally, we saw how immense patience and precise movement don't just repair shoulders, they forge a path to physical and mental autonomy.
It really is a blueprint for resilience that extends far beyond a Pilates studio.
It really is.
And it leaves us with a concept that I think is incredibly important to sit with. Not just for cancer survivors, but for anyone navigating the inevitable changes of a human life.
What's that?
Well, we've established that trying to forcefully snap a traumatized body back to its before state is just a recipe for chronic pain and frustration.
Yeah, it's a battle you will eventually lose.
So, moving forward in your own life, What if you stopped judging your physical worth by the things you used to be able to do?
Hmm.
What if the true measure of your health isn't about what your body can forcefully accomplish, but rather how comfortably and peacefully you can inhabit it as it inevitably changes?